Good afternoon. First of all, I want to thank Springfield Focus, Steve Carey, for outstanding work and continue to bring messages to the broader Western Massachusetts community. Thank you, folks, for participating in this Springfield COVID-19 Black Coalition. People have been chosen and reached out to begin our dialogue on today. This is nowhere near the end of the coalition. This is just the starting point. We have literally close to 50 people who will be participating in this coalition, but to get started, we wanted to have a general conversation because Thanksgiving is here, the holidays are coming. So we wanted to jumpstart our coalition just a little bit. So I'd like to reach out to Bishop J.P. Morgan, Chairperson, Doris Harris, Vice Chair, Andrew Cade from the Urban League, Barbara Gresham, Dr. Neil Boyd from NAMI, Ron Johnson, Martin Luther King Community Center, Denise Jordan, Springfield Housing Authority, Minister Lewis from the Black Mental Alliance, Dr. Bobby Rentix, Dr. Gloria Williams, Willette Johnson, Janetta Bayman, Bishop Talbot Swan, who cannot be with us today, he's out of town, NAACP, and Ayanna Crawford, who will be representing community-based agencies and the youth of the city of Springfield. This is a very important charge, I feel. I just think that in order for us to focus on urban and one of the gateway cities of Springfield, that this committee will be charged with economic development in terms of seeking grants, seeking funding for our PPE, seeking funding for our community centers, our synagogues, our mosques, and our churches. And last but not least, we're going to hear from our health commissioner, Dr. Helen Colton, who is doing outstanding work in the city of Springfield. And also we want to make sure that testing, we don't want to be a testing desert in the Mason Square and the greater Springfield community. Also remembering that a lot of businesses are going out of business. And let me give David Lewis's title. Again, if you flash that again, sir, I will get that in. So if you have to hit me back, put that back in the chat box. PPE, I've said that. And also, we're looking for the money for funding for individuals. And we know that Congress, the CARES Act, great, but our people are hurting. And certainly this coalition will be a voice for the voiceless. And we will be talking in a unified voice. With that being said, the first voice you hear really needs no introduction. She's the health commissioner for the city of Springfield, and we all know is doing a very outstanding job. I've asked her to give us a charge, so we will stay focused, be about business, and be about the people's work. Oh, none other than Commissioner Helen Colton.
Thank you, Councilor State Rep Williams. You are also doing an amazing job. I apologize, I cannot be on screen. The city of Springfield does not have cameras on our desktops. We hope to remedy that soon. And so I apologize in advance. And so if we could put up the slides, what I'm going to do is just start us off on the same level of development from an educational perspective. And then I'm going to go through these quickly. I realize our time is limited. And so I'm going to start with just what you already know, what coronavirus is and how it's spread. We know that it's spread through viruses, through infected people by coughing and sneezing and touching an infected person's hands or face, or by touching things such as doorknobs that infected people have touched. So coronaviruses are not new. Coronavirus have been around for a while, but this one is new. That's why it's called novel coronavirus. We have not experienced anything like this ever in the history of the United States, except for 1918 pandemic. Steve, you can move to the next slide. I will just pause, and if you move automatically, that would be great. Doctors and health officials, community spread, that's what we're dealing with right now. The numbers you're seeing have to do with community spread. And community spread happens when people don't really know where this virus is coming from. It is in the community, it is widely circulating, and that is what's happening right now in the city of Springfield and across the nation and Commonwealth. Steve? So how do you prevent the spread? You all have heard this so many times, I don't need to tell you. Wash your hands, make sure that you're staying at least 6 feet from someone, don't touch your face, use a face covering and or masks, and it goes into what a face covering is. But I should say that a face covering, while it says masks and scarves and bandanas, they need to be tightly woven. And so that the regulations really speak to layers and being tightly woven. So everything that you cover over your mouth is not considered an acceptable face covering. Next, Steve. So we know that there's no specific treatment for COVID-19. The good news is that there is a vaccine on the horizon. The Moderna and Pfizer vaccines are on the horizon. We hope, I just got off a call with the State Department of Public Health. We hope we have vaccine in our hands by late December. There is a priority for the vaccine. As you all know, it's healthcare workers, first responders. There is a list that will, that have been provided to us. We will not have that vaccine for general population probably until March or April. That will come through the Board of Health, through this department. We will set up emergency dispensing sites so that we can vaccinate the general public. But I do not anticipate that happening until February, March, and perhaps as late as April. Next slide. And so when someone is COVID positive, they're in isolation. If you're COVID positive, you isolate yourself, you stay away from other people. You are the source. And so the source must be isolated. Quarantine separates and restricts people. So if I'm the source, my family then must quarantine because they have been exposed to me. So isolation and quarantine are two separate actions within the same family or cluster of individuals. Next slide. So contact tracing, I think you already know that contact tracing is what we do when a person is positive. We reach out and we call individuals, we ask them who they have been in contact with, and then we follow up with those individuals. That is an area that we can talk about as far as needing support is concerned. You know, as Black people, we are not accustomed to giving our private information. So sometimes when my staff calls and is contact tracing, people may be reluctant to say who they were around or what the actions were they were involved in, but that's not our job. Our job really is to find out who those individuals are so we can trace the contacts, trace the infection, and make sure that we are doing what's necessary in order to keep our population healthy. Next slide. So the impact on the Black community, the striking overrepresentation of Black people among confirmed cases is seen by state data, including the Commonwealth of Massachusetts. So the coronavirus is amplifying pre-existing social inequities tied to race, class, and to the healthcare system. Next slide. So why do Black people have a higher infection and death rate from COVID? So we know everybody is at risk for COVID, but the severity of the infection and the mortality among Black individuals is extremely high. And so we know that Black people are more likely to have pre-existing conditions such as diabetes, heart disease, high blood pressure, lung disease, and obesity. All of these contribute to a more severe and sometimes fatal course of COVID-19. We have a history of health disparities, including less access to healthcare and inadequate or no health insurance. Both lead to less preventative care, more hospitalizations, and a higher morbidity and mortality rate. Next slide. Black people, we are more likely to live in urban areas that are densely populated. It's difficult to practice social distancing, quarantine, isolation when living in crowded conditions. Only 1 in 5 Black individuals can telework or work from home. We are more likely to be essential workers in transportation, government, healthcare, and food supply services. And we disproportionately occupy low-wage or temporary jobs that may not provide sick leave, so we have to go to work in order to feed our family, and we are more likely to be without a car and more reliant on public transportation, which, as you know, can lead to being around more individuals and having the potential for COVID spread. Next slide. And so I'm going to just share with you a little data from the city of Springfield. This was this week that I presented at our press conference. And so the week of November 1st, there were 399 cases. Week of November 8th, there were 670 cases. And then the week of 11/15, which was this previous week, there were 632. What's unique about that is we have not seen those kind of cases in our city since April and May. So we are having a surge, which is across the Commonwealth and nation, but it is disproportionately hitting Black and brown communities in the city. Next slide. So I'm just showing you right here a 3-week case rate. And so this goes back 3 weeks to November 1st, November 8th, and then this past week. And you can see over those 3 weeks what the cases look like in the city for those 3 weeks. And again, there are very high rates we're experiencing right now. Next slide. And so let's talk about ages. What's different about what we're experiencing right now in the city of Springfield and across the nation is that we're seeing that 30-year and under age group is just really growing. That is where the majority of our cases are right now. If you add that to the 31 to 50, 79% of the cases we're seeing right now are under the age of 50, and the 51 and older is 21%. Now, 51 and older is important because those are the individuals that will wind up in the hospital potentially. The average age of hospitalizations right now in the Commonwealth is 66. The average age of death is 81. And so that 51 years and older is an important statistic to take a look at. But that 30 and under, 44%, very different than what we saw early in this pandemic, because we saw it in older adults and in nursing homes. So the demographic shift has happened. Next slide. I'm just showing you at this point, I just gave you an overview, but if you look at this, you'll see that the numbers for 0 to 10 years old, this is just last week. We had 61 in the 0 to 10 year old, 96 in 11 to 20, and then the 21 to 40, 119, 31 to 40, 115, 106 in the 41 to 50, and you can read going down. But again, that 51 and over, that age group is something that really concerns us. But the primary source of infection in our city right now is under the age of 50, primarily under the age of 40, to be quite frank. Next slide. And so this really is the confirmed cases by zip code. I'm going to go over this very quickly. You can see the zip codes in the city. And I should say that the zip codes do represent a population base. So when you look at these numbers, we know that there are more people living in 01104, 01108, and 01109. So we're going to have more cases in those zip codes. But when we look at the map, and I'll send the map out, you'll see the clusters. It's not all over that zip code. We're looking at clusters within zip codes on the same street, in the same houses. And so we know that there's a relationship. Small gatherings are tending to be the primary source of this infection. Next slide. And so this is the zip codes percentage that have been broken out. Again, even though you see 19% in 01104, there's 19% of the population living in 01104. 01108, 18%. There's 18% of the population living in there, and 01109, that 20%. So it's not so much the population base, but rather when we look at that zip code, where the infections are and where we're seeing those clusters. Next slide. So this is the confirmed cases by race. So this for me is difficult because you see that it is the unknown cases, that there are a lot of cases where there is no race assigned. And why is that? Either when the individual did the test, they did not ask, or they did not write their race down, or that the race that they identify with was not available. And so that unknown really concerns me because we don't have a good idea who that really represents. White, 31%, these individuals said that they were white. Again, Latinx, same thing, that's 28%, but there's no Latinx box or Hispanic box or Puerto Rican box to check. It really says other. And so the state has made the determination that other really does relate to Latinx. Last week, the Black African-American number was 11%. That is misguided on some levels because of that unknown that I just talked about. I know that there are Black and African-American individuals in that case rate. We're trying to drill down on it now. Next slide. So that's the end of my presentation. So when State Rep Williams, and I really appreciate him because he really is very concerned about our community. He was very, very concrete around what he wanted to think about. And you all will talk about this and we'll talk about it. The economic impact that it's having on the Black community is really stark. All you have to do is go to a food bank and just look at the lines. And you will see the disproportionate number of us who are in those lines because we don't have food security. So food insecurity is really a challenge as far as the economic impact is concerned. I took a look that just came out from the Commonwealth of Massachusetts around the small grants that were handed out to cities and towns. I did see New North Citizens Council. I saw nothing in the Black community in the city of Springfield when I looked at that list. Now, maybe I just did not pick out that community-based organization, but I didn't recognize it. I did see where New North Citizens Council was represented. So that's a problem. When we can look at a list where funding and grants are going and we don't see ourselves in that number, then that's a real problem. Children and education. I know there's work being done around children and learning, and I am very concerned, and you should be concerned, that our children, and we have an amazing Dr. Williams, Dr. Renix on this call, but what we know is that our children may never catch up after this pandemic because of learning remotely and because of falling behind. So paying attention to African-American children in this educational system and assuring that they have the support. And I know some of that is happening with the MLK Center. The other one is mental and emotional and spiritual health. And I know that our pastors will take care of having that conversation, but we already know what's happening with mental, emotional, and spiritual health. People are depleted, their faith, they're not able to practice, they're not able to be together, and that is having a devastating impact. We are seeing an increase in suicides amongst children and suicides amongst adults. Much of that, and in the Black community, we are not usually ones that take our own lives. And so when you see that happening, you understand that there's a desperation that's out there. So mental, spiritual health. The other thing I'm really going to need your help with is the vaccine distribution campaign. We do not trust the medical community. So when folks come with their vaccines and say, please take this, we are going to be the ones that say, wait a minute, we have a history with you and we don't really trust that this is going to be something that we are going to want to take based on your recommendation. And so I think to have a group like this very, concretely come together and help with that education around the vaccine educational campaign. I will be setting up emergency dispensing sites when it's our time to distribute to the community, but the community is going to need to want to hear from trusted voices. And so that is really the charge that State Rep Williams has asked me to articulate around the economic impact, the educational impact, the mental, emotional, and spiritual health impact, and then assistance with the vaccine education campaign. Thank you.
Thank you for that tremendous charge and historical perspective. And to her point, and I've heard this afternoon, there's 50,000. There was 2 grants distributed to Western Massachusetts. One went to Holyoke, and one went to Springfield, which was the New North Citizens Council. It was $50,000. I didn't see anything in there for Mason Square. Okay, moving right along. Thank you, Commissioner. And we will certainly look forward to working with her, and tremendous information. And it really, I thought, captured the spirit and also enlightened a lot of individuals, because that's how we want to be. We want to be fact orientated and not opinion orientated. So at this time, I ask the chairperson of this distinguished committee, Pastor J.P. Morgan.
Thank you so much, State Rep Bud Williams. I love the presentation that our Commissioner Carlton gave. The information that she pointed out is so important, and this is the reason why we are meeting. Let me, and I'm just grateful for all of you all to be a part of this this meeting tonight. Let me just, by way of definition, just point out a mission statement for the Black Springfield COVID-19 Coalition. We are a group of stakeholders, thought leaders from the city of Springfield, forming a united effort to call for decisions, policies, and actions taken and resources committed to our community of residents and businesses, make sure that they are effective. And when we talk about effective, we define effective as successfully stemming the contradiction and transmission of COVID-19 and leaving Black residents and Black businesses in a better place post-pandemic than we were before and during the pandemic. I recall in her presentation, Commissioner Carlton Harris talking about making sure that our youth especially is educated in our community when it comes, because we're already suffering when it comes to what our young people know. So I really appreciate that. We're looking to leave our residents better than prior to this dread pandemic, and even during this pandemic. And then we believe the only way to accomplish our mission is to join in, partner with others in the community, and interject ourselves into several aspects of the response and recovery process. I want to thank Commissioner Carlton for that, the charge that she gave us. There's a couple things that we want to concentrate on that we were talking about. One is economic development. So when State Rep Williams was talking about the necessity for funds that we need in helping to maintain COVID sanitized spaces for houses of worship, mosques, synagogues, community agencies, and small businesses. I think those kinds of things are very important. When she talked about people feeling displaced for the last 8-9 months because we have not been able to come together. As a pastor, we have not been able to come together in houses of worship. We are teaching, working with our kids while they are hunkered down at home, and things of that nature are important. And so we want to be able to have, and it's not cheap. to get your church cleaned. If you try to get it cleaned, it ain't cheap. But we are looking to find ways where we can have socially distant, safe spaces to meet in a limited capacity. So we're concerned about money for that, not just for churches, but like I said, for community agencies and small businesses. And then Ms. Harris is going to talk about and really talk about education and outreach, which is going to play an important part on what we're trying to do. I think that not enough people know the truth about COVID-19 and about its real effects on the community. Everywhere you look, there is a lot of disinformation that is going out, and people don't always know who to believe. And she's right when you talk about people need trusted voices. And so it is another important thing to make sure that we are getting the facts out and not myths. So part of our responsibility I'm looking at is debunking the myths and dealing with the facts and getting those facts to all of the people that are in the urban neighborhoods, our Black families, et cetera, et cetera. So that's basically our mission statement and the things that we will be concentrating on in accordance with the charge that our commissioner has given us, certainly to be a help and a support as we give people the necessary information when the vaccine does come out. You know, they need to hear from us that it's okay for you to get this vaccine. So all of those things are important. That's kind of basically our mission statement and our basic concerns. And I know Dr. Doris Harris is going to have some more to say regarding education and outreach.
Thank you, Pat. Thanks, Reverend. And absolutely, in the spirit of Bishop J.P. Morgan, we want to thank you for your continuation for the hard work to protect this community. At the next voice, we'll hear Dr. Harris, who has a great program, Healthy Matters, has been talking to the greater Springfield community for many, many years in terms of health. When she finishes, we're gonna have a few more minutes. I'm gonna open the floor up and ask the health aspect to be addressed for 2 or 3 minutes. I'm going to ask that the educational aspect be addressed and probably housing. So you folks stand by. I'm going to be calling people. So Dr. Harris?
I want to say good afternoon to everyone. I do appreciate the honor Representative Bud Williams, Commissioner Helen Carlton Harris, and Bishop J.P. Morgan Jr. for allowing me to be part of this important initiative. I am looking forward to chairing and helping with the education part and outreach, but I know that it's not just me alone. I am honored to be among a distinguished panel of people that I have worked with before, and I have seen wonderful different types of initiatives that they have done within the community. During this COVID-19 pandemic, it's essential that we educate, encourage best health practices, and promote a community-based strategy that will not only promote effective ways of dealing with the pandemic, but also save lives. The dire consequences and not the time that this pandemic has lasted has brought about a feeling of hopelessness in all communities, but even more so in the Black community. It is imperative that this coalition initiative work be in collaboration with state, city officials, community organizations, businesses, faith-based organizations, along with healthcare systems. As we move forward, we are considering a series of activities to begin the community coordination of education and outreach. Some of the things that we are looking forward to doing are PSAs, public service announcements, a COVID-19 health webinar, distribution of masks and sanitizer. And we have some other things that we would like to propose, but we want to make sure that this will be the best for our community. I agree wholly with Helen Carlton Harris, because our community sometimes doesn't trust. And they have reason to trust. There is a history of different types of research and scientists kind of tests that people were privy to. One that stands out is the Tuskegee. And so it's important that people can identify with others that look like them, that can encourage them to move forward and getting the best health care that they possibly can do. So again, I look forward to moving in a positive direction and hoping that we will make a significant impact to save lives.
Amen.
Thank you.
Fantastic. Hey, thank you. And thanks for reminding us of the Tuskegee study. If we'd forgotten that when people were shot up with syphilis within our community, and that mistrust still lingers on. And there have been plenty of other cases. I'm not going to get into them. Right now, we're down to about 13. We've got about 15 minutes. What I'd like to do now, I'm going to try to give each individual a couple of minutes just to hone in on your particular area, realizing that we have a lot of information, we have a lot of work to do, and hopefully within the first couple weeks of December that we will have our real first meeting. This is almost like a launch with about 10, 15 people. The first individual, I want Minister Lewis. I'd like you to chime in on the mental health aspect, if you don't mind, sir.
Good afternoon, or soon to be evening. David Lewis from the African Diaspora Mental Health Association. This is very important. This is just added stress to the already different stressors that we as Black people that affect us in mental health. One of the major things that we've been doing is trying to definitely dispel the stigma, because we don't trust. And one of the reasons we don't trust is because we don't see people that look like us and don't know, and they don't understand us. So we have a outpatient mental health clinic, full outpatient mental health clinic right here on State Street, where we've been doing the work for the last 2 years here. We've been doing the work individually, but now we have a place where we have professional and talented therapists and therapists that look like our folks. And so, and that understand the different stressors, the different things that affect us. So we're excited that we're able to be a part of this. Thankful for telehealth, that we can continue to provide the services to our clients. We've lost some clients due to this COVID, and even having to, I do therapy, but I also supervise, and so supervision turns into therapy because of this, because of COVID. So we're all affected, and again, when you lose a client, it's hurtful, So we're excited to be a part of this coalition, and our doors are open. They're closed to the public, but you can go to our website, www.admha.org. It's comprehensive. It's user-friendly. You can do referrals, job referrals, to be a clinician here. And, we're just here providing the mental health services to people, to Black folk. But we get
Reverend.
lost, just real quick, because we get lost in the term minority. We get lost in the term people of color. We get lost in all that and lose resources. You understand? We have to be, and we are unapologetically Black. And that's just what it is. We need services and love our brothers and sisters that, you know, that are in that label of minorities. But we, as the Black community, we're suffering.
Okay. Minister, Rev, can you do me one quick favor? We talked on Friday. Just hit on that post-slavery stress for about 45 seconds, if you don't mind.
You said me?
The post-slavery stress we talked about the other day.
Post-traumatic slave syndrome. Post-traumatic slave syndrome is we haven't dealt with the trauma from slavery, from post-slavery, in slavery and post-slavery, and civil rights. And so there are behaviors, there are attitudes, there are things that we do that are directly related to that response. Trauma, sometimes you don't even know where it's at, where it comes from, where it originated at from, and it causes all kinds of behaviors and attitudes. The way that we treat our women, post-traumatic slave syndrome symptom, gun violence, drug addiction. You understand? All that stuff is our response, our reaction to a trauma that has never been dealt with. Oh, just get over it. That was 300 years ago. Everyone else that has been traumatized, every other culture that has been traumatized in this America has been recognized and given some type of attention. We've never had any attention. We've never had any relief or acknowledgement of the atrocities that we faced then, afterwards, and even right now. And it's because that hasn't been dealt with, we're dealing with this stuff now. School to prison pipeline, our criminal justice system, our healthcare system, the systemic racism in the court system. Every system, we are racially affected. We are discriminatively affected.
Thank you. And the only reason I wanted to bring that point, and then you take COVID-19 and put that on top of all of that.
That's why it brings it to a whole different level, a whole higher level.
That was the point I was trying to make. But thank you, Rev. We're going to really be getting to a lot of information. At this time, we still have about 8 minutes left. I'm going to ask Dr. Winston, the education piece of this, to give us a couple of minutes of how education is being looked at through the lens of the educators.
Oh, thank you, Bud. First, I would just like to applaud the folks who have done the research and is sharing the data with us in the community. We see how serious this situation is, and for me particularly, when it hits the family, we've lost a brother-in-law, 2 cousins in our own immediate family, and we really weren't sure of the impact until it hit us. So I think there's work that needs to be done. There has to be the educational component of it, and that's for the young, the not so young, and the community at large in terms of the seriousness of this epidemic. There needs to be the outreach, and so there are a group of educators who are accustomed to working with youngsters as well as adults. And I think that the group has made a commitment to do our part in terms of working with this coalition to get the message out about the seriousness of this pandemic and have some input into what we can do to help in that aspect.
Okay, thank you. Thank you very much. Dr. Cade, still there?
I'm here.
Yeah, we have, the Urban League works with a lot of our seniors, and I talk to Andrew almost 2 or 3 times a week. We're talking about remote learning for seniors and trying to get PPP equipment into seniors. Can you just sit on them seniors for a minute, Dr. K?
Yeah, we have approximately about 145 seniors that are represented through Berkshire, Hamden, Franklin, right throughout all of the counties. What we've provided has been PPE equipment to all of our seniors. But as someone indicated before, we really have to reach to the resources to see if we could designate resources that would be available, because the PPE equipment that runs out pretty quickly. And so we need to have equipment available at all times for our seniors. So one of the things that we're going to do is continually to search for some of the resources. We did get a grant from the Western Mass Foundation, Community Foundation of Western Mass. So that was a great hit for us, but we can't go to them every time. So we are going to continue to look for resources to at least help our seniors. One of the questions I want to ask, and I would like to just thank Commissioner Colton for a very succinct presentation. We talked about, well, she indicated, she talked about trusted voices. And I think that is going to be really key when when it comes to disseminating the vaccines, because there are a number of people, as has been indicated, from our community would not really partake in the vaccines. And I think we need to have someone from a clinical, medical perspective, someone that looks like us, that can delve into what we're actually consuming for the vaccine. And I think that would probably lend more of an opportunity for people to partake in the vaccination. So that was just one thing I would like to see if this committee can pursue. Yep. Getting someone who's technically astute to come in and talk about what we're taking and what we're consuming.
Yep, I agree, because even when they were doing the trials, Moderna and Pfizer were doing trials, they had a hard time getting people, Black people, to even take the trials. In Boston, they couldn't get people. It was very difficult, very hard. Those trusted voices are clinical people, doctor, and people like us. Are we getting now? I think we got about 5 minutes left. I want to ask, is Ayanna Crawford still there to represent the youth? And then Bobby Renix, and then Reverend Morgan's going to close it out. Ayanna? Is Ms. Crawford there?
Yes, I'm here.
Oh, okay.
Yeah. First of all, I'd like to say thank you so much, State Representative Budd, for this opportunity to be a part of this illustrious committee. I too have worked and certainly highly regard all of you in our community and your professional work that you've done here in the city of Springfield, particularly and especially around health and also the social, emotional, and spiritual development of our community. And so I'm certainly honored to be here with all of you to understand and to really move our community forward in terms of how our youth are really seeing this deadly virus. And that's what it is. It's a deadly virus. And so as our illustrious former principal of our city, Great of Homes, stated that education is key. And so I believe in working in tandem with all of you to really help educate our youth, those that are in the adult education programs and or elementary and or high school level, and really helping them understand certainly the symptoms and the ways in which their behavior has really contributed to some of these outbreaks. And so we want to be able to be there and understand and help to educate and be a part of a campaign that not only helps to help families and children, but certainly our youth directly, and really speaking to them and using their language, and also using what they do so well with social media. And so we want to help you with creating a social media campaign that's going to look at these particular areas, Twitter, Facebook, and TikTok, to help you sort of reach out to our youth so that we're speaking their language. Thank you so much, and thank you for all of you for your hard work on this committee.
We have Steve, 2 more minutes, please. Ayanna, I just want to thank you, because I've attended a lot of COVID coalition meetings in Boston and Zoom and everything. And there's never been much attention on the social media and TikTok. I mean, thank you. That's a great perspective, because you got to go that way, because young people that's what they're listening to and talking about. Dr. Renix is going to give us a minute or two, and then we're going to close out with Bishop Morgan. JP Morgan.
I'm unmuting. Thank you so much, State Representative Williams and Commissioner Carlton and Bishop Morgan and everyone else that's included in this great coalition. Dr. Williams and I work very closely with education, and been in education for basically about 50 years here in Springfield. And I've always focused on the foundation, elementary education. And we have been very concerned about the education of our children. On average, Black students typically score 1 standard deviation below white students. So they've always been behind, and now I'm concerned. And then I look at the upper grades, the middle school and high school, but my concern is if you can't read in first and second, K1 and 2, that's where the focus is. I was a first grade teacher, elementary teacher for over 20 years. And that's where we need to look. And I'm very, very much concerned with the education. And that's where, and thank you for including me in such a great coalition, because that's where that's definitely where we need help, is in that education piece. And we need to start early and to continue it all the way through. It's very concerning. Colleges concern me too. My grandson is a student at AIC this year, and I'm very concerned with the safety of those students and how they are reacting to the COVID. Thank you.
No, thank you. And we have JP Moore is going to close us out. But Willard Johnson, you're not a Zoom bomber. You are a member of this coalition. We had added your name, so you should have been admitted. So Willette did chime in. I want to thank members of the coalition. Thank you very much, so much. Very important work. It's God's work. It's the people's work. And we are going to be the voice for the voiceless, and those to the least of them, those who are down in the valley. So Reverend Morgan, can you close us out? Thanksgiving's coming. Christmas is coming. We probably won't get together. Well, we hopefully will get together before Christmas as a unit, but we need a little message from you, please. And
yes, sir.
You'll have the final word.
Yes, sir. Thank you so much. I just want to say thank you for allowing me to be a part of this august body of great community workers and professionals. I just feel privileged to be able to come together and to serve with you all, because that is what my life is about. That's what I've been called to do. And everything that I've been hearing has to do with, and the main question I've been dealing with is, what are the cracks that need to be filled? And I think together we will be able to fill in those cracks and be the bridge that's going to get us from point A to point B, actually point A to point C, because point B will already be taken care of. So thank you so much. As Thanksgiving is coming, the only thing I want to say is, and me and Representative State Rep Williams were talking about this, the importance of family. We cannot afford to be frivolous in our behavior. We cannot afford to be cavalier in our behavior as if this does not exist, no matter who you voted for. I'm not judging anybody for who you voted for. This is about life. When you come to the holidays for us especially, is about family and the importance of family. And I am concerned, and we should all be concerned, that our families ought to have a future. So I want to admonish everybody to just, let's spread the word, let's be safe, because we want to act like we're grateful for life. To me, if we haven't learned anything during these 9 months, I think a significant takeaway from this COVID-19 is that life is a gift, and a gift to be cherished. I've lost, like so many of you, I've lost loved ones. My father had 9 siblings. He only has 1 living sibling left, and the other 2 were taken out because of COVID-19. And so life is a gift to be cherished. So as we go into the holiday season, let's live and act and encourage everybody to behave as if their life matters, because it does, and be very succinct in doing those things that will allow lives to continue and allow a great living legacy for all of our Black families. So I just want to say thank you so much. God loves us, but we need to love ourselves. And so I'm glad the mental health piece is going to come in and teach us how to love ourselves, Lord. All right, listen, I'm done. Thank you so much.
Thank you. And Steve, want to thank you again, Steve Carey. Big kudos out to Steve. Thank you.
Steve.
Thank you all. Thank you all. We do have to run to City Council, but we'll get this. I'll send this link to you guys a little bit later. But thank you very, very much.
Thank you, folks.
Thank
All right,
you.
thanks everybody. Thank you.
Have a safe Thanksgiving.